Hi folks, Dermdad here. Let's talk about ultraviolet light and how it affects coronavirus. And this clearly has been in the news lately. So wanted to take a few minutes and just touch on this subject, especially in terms of if it can be used effectively to eradicate virus particles and specifically the coronavirus that we're dealing with. Ultraviolet light, also known as UV light, comes in three different wavelengths, A, B, and C. Each is a spectrum. It is near to the visible light spectrum, but it is invisible to the eye. But it does carry quite a bit of energy, and it is seen in natural sunlight, but usually is blocked by the ozone layer. Hence, there's not a lot of UVC light normally reaching the surface of the Earth. UV light is quite powerful and can have many different effects on the objects that it hits. In particular, it certainly does penetrate skin cells as well as bacteria and viruses and causes DNA and RNA damage, which eventually can deactivate the bacteria or the virus, which would be the desired effect in this particular situation. UV light is commonly used in both laboratory as well as hospital type environments to kill off bacteria and viruses and to essentially sterilize not only equipment but also rooms. Especially after having patients and germs in these rooms, it is essential to use an effective and safe form to sterilize and remove all of the bacterial contamination as well as the viral contamination. Now, UV light also penetrates skin, especially through the epidermis and down to the upper levels of the dermis, causing significant damage. It does cause DNA mutations and damage to the DNA structure itself, which is very important. We often see this in the manifestation of skin burns, but more importantly, it can cause skin cancer and certainly cause long-term damage. Here we see an example of what appears to be a melanoma on a patient's skin. Now, in addition to melanoma, UV light can also increase the risk for squamous cell cancers and basal cell cancers, which are both quite common, with basal cell carcinoma being the most common form of cancer. Furthermore, UV light can also penetrate through the eyes and damage the retina of the eyes. This is critical to note as it can cause temporary as well as certainly permanent blindness depending on the amount of UV exposure, and it really doesn't take a lot of UVC to cause permanent damage to the retina. This is the reason why many sunglasses have UV protection built into them. So where does that leave us? The bottom line is UV light is great for sterilizing objects and surfaces. It certainly can be used on food packaging or instruments or basically any kind of object where the UV light can penetrate the surface enough to disinfect and kill off the bacteria and the viruses. It can also be used to sterilize equipment, which we have seen in the hospital type setting. Some hospitals are now using UV light to sterilize N95 masks in between shifts, and this is a great feature. But there is a caveat as it can cause degradation of the materials, and oftentimes the UV light can be used for 2 or 3 cycles before the mask needs to be replaced. But it is important to note that UV light cannot be used to disinfect people. It is quite dangerous to the skin as well as to the eyes and causes long-term damage, leading to skin cancer, possibly blindness, and mutations within the genetic structure of the cells. Since natural sunlight does have UV light in it, it does have some natural disinfecting properties, but the amount of UV light in sunlight, and specifically the UVC portion of it, is much less compared to the highly concentrated rays needed for actual sterilization. So bottom line is this, UV light has its place. It is certainly used by many hospitals and other organizations. You can even buy home UV light units to disinfect items, packages, and surfaces. But UV light certainly is not appropriate for using on human beings, or for that matter, any living creatures. So I hope that helps, and as always, thanks for listening and stay safe.